Surgery usually takes 2 hours for us to complete everything. Afterwards, we'll take you to the recovery room. The recovery room nurse will make sure that any pain you may have is being taken care of. I'll go and talk to your family afterwards, and I'll explain how everything went. And then we'll get you to the room so you can recover, and I'll have a chance to talk to you then.
After surgery, the patient will be taken to post-anesthesia care unit. They'll be hooked up to oxygen, to their pulse ox, also to their blood pressure cuff. Vitals will be taken during this time. Their pain management will be watched over very carefully. While the patient is in post-anesthesia care unit, they will be unconscious or at least asleep for the time being. Sometimes they do wake up, but that's when their pain is being managed. At that time, they're going to be going up to the recovery unit.
Dr. Kella told me that I was going to have a sedative, and I remember being told about the sedatives and that I wouldn't feel no pain. And basically that was about it till I got to my room. When I woke up, I felt some discomfort, but the medication that was given to me just took it right away.
We're going to make sure you feel as comfortable as possible. So if you're having some pain, the recovery room nurse or the nurse on the floor will give you the medication so you'll feel better. That's really important to us because we want you to feel comfortable so you can start walking. Usually you'll be able to walk that evening or first thing in the morning.
Well, the 5th Surgical Pavilion is a post-operative unit where we take care of patients after they have surgery and they come back from the recovery room. It's a very quiet and healing environment, very patient and family focused. Every room is a private room. Your family member can stay with you if you'd like them to. We have just for you room service so that you can order what you'd like, when you'd like to eat it throughout the day, and of course refreshments here on the unit during the night. We also have very caring staff that will help you heal and get home with your family soon.
Well, this is one of our suites up on the 5th floor. There are larger rooms. The suites have a separate area for our families to stay in so that you'll be comfortable and have your family support with you.
I really appreciate it because he was in a room by himself, so that gave me an opportunity to be with him. I feel like we've been VIPs. They've really given us, I feel like, one-on-one care. Really, really exceptional.
Well, what we do here on 5th Pavilion is we want to make sure that we're managing their pain. So that's the first question that we ask them once we get them in the room. If they're in pain, we're going to medicate them for pain. Next thing is if they're nauseated, which usually they aren't, but if they are, we do have medicine to give them for that.
Well, once the patient's on the floor, you'll be able to soon walk around. You're going to have a tube down below, which is the Foley catheter. You'll also have a little tube coming out of one of the incisions, which is called a JP drain. Usually we can get that JP drain removed before you go home.
We start them on a clear liquid diet as soon as they're able. And they stay on a clear liquid diet until they start passing flatus, get their bowel function back, and then we advance them to a regular diet. Usually won't happen until the 2nd day, around lunchtime. Another thing that we do is we get them up and move them around as soon as we can, when they're more awake and when they're able. And that's for several different reasons. First being they'll feel a lot better once they do get up, which is very important to them. Second is to prevent clots and any complications. They also breathe better when they're up moving around.
Oh, it feels real good. I couldn't imagine I'd feel this good day after surgery. Hope to get home, see the family, and maybe do some dancing pretty soon.
And then we start doing some teaching as soon as they're able to on their Foley care, which they'll go home with, and their leg bag. We try to do it as early as possible so that on the day of discharge, they're not overwhelmed with all that information.
The morning after the surgery, I'll come by and I'll visit you and the family. We'll go over again how everything went with the surgery itself. I'll make sure everything's moving along smoothly. We'll talk to the nurse. We'll take a look at your incisions. We'll look at the drain. We'll look at the catheter. Usually you can expect to go home that afternoon time. We'll make sure that you don't feel bloated. We'll make sure you're walking and that you just in general feel comfortable. Typically the drain will come out and you'll go home with just the catheter, and then I'll have you come back and see me 1 week later in the office. Once you leave the hospital and you get home, I want to make sure you feel comfortable with walking. I encourage you to walk. You should not do anything that creates pain, so if it starts to hurt, you're probably doing too much and you need to just take it easy a little bit. You'll be able to take stairs. You'll be able to be driven, but I prefer you not to drive while the catheter is in place. And as far as lifting goes, you want to limit yourself to probably 10 to 15 pounds. If you do more than that and you start to feel abdominal strain, we don't want anything to happen to those incisions.